Now we're going to talk about some assessments that your client might go through and tests that your client might go through to see whether or not they do have some sort of CVD or how that CVD is progressing or regressing. So let's think about the kind of basic assessments. So a chest x-ray is or can be used to assess the size of the heart. And so if you see an enlargement of the heart, particularly that left ventricle, that's usually indicative of having some sort of cardiovascular issue. It's also used to identify certain structural cardiovascular abnormalities. So if there's any kind of differences in the heart size or shape, and detect fluid in the lungs. The resting ECG or electrocardiogram is used very commonly to look at someone's CVD health or cardiovascular health, and it examines a client's heart at rest to evaluate the electrical impulses that are actually going through the heart and emitted by the heart. And this can actually be really helpful in identifying if that person has any underlying heart arrhythmias or irregularities. Ultrasounds are used because what basically they do is they take high frequency sound waves, and those sound waves will actually create a graphic image that that person can then interpret to see if there's any changes in the cardiovascular system. ABI, or ankle or brachial index, essentially compares the blood pressure, the systolic blood pressure in the upper arm as well as the systolic blood pressure in the ankle. And then if the reading in the ankle is really significantly lower than that in the arm, what we know is there's probably an increased risk of peripheral artery disease, or PAD, or some sort of atherosclerosis of the lower extremities. Because again, if we have a much lower systolic blood pressure in the ankle versus the arm, essentially think about that. What that's saying is that we're not able to adequately have blood flow through our extremities, particularly to our periphery, in a way that we need to. So by the time it reaches our lower body, our ankle, the blood pressure is significantly lower, and that's indicative again of having some sort of blockage or some sort of issue in the vascular system. So that's why, again, the blood pressure would be much lower in the ankle. And then risk factor profiling is something you all are probably a little bit more familiar with. And essentially it looks at assessing their traditional risk factors for CAD. This can include things like blood pressure, indices of diabetes, so measures of obesity, cigarette smoking, metabolic syndrome, cholesterol, physical inactivity. And so again, we're kind of, ACSM has moved away from the risk stratification from an exercise test or exercise professional. So as a personal trainer, you know that we typically only do this risk factor profiling in clients who are a little bit older. However, if someone has CVD risk, I would highly suggest that you go through this process with them because it's an important thing for you to understand. And again, you never want to be negligible. And so there's a really nice tool online, this hyperlink you can click on, helps your client actually kind of go through this process. But my guess is if they know that they have CVD, they've probably gone through this already. But I wanted to give this tool for you just in case you haven't done this with them before. Okay, so those are kind of your basic tests. Now we're looking at our intermediate tests. So these are the ones that are a little bit more intrusive and require a little bit more time. So an exercise stress test is the same thing as a kind of resting stress test, except for now you're going to have them perform exercise on either a treadmill or a cycle ergometer. And again, this is where you have the electrodes, so the EKGs that are kind of all on their chest, and there's either 3 lead or a 12 lead. If you're really interested in this stuff, I highly suggest you take that class as an elective because we have that class. But basically, they have these different electrodes that are on their chest, and those electrodes are able to measure what is going in the heart, right? What are the rhythms that are happening in the heart? And then as the technician, we can look at the rhythms of the heart. We can also look at heart rate and blood pressure, and then, like I said, EKG response. So that's really important because, especially for us, we're most likely encouraging our clients to be physically active. So it's not just important to know what their EKG looks like when they're in rest, but also when they're exercising as well. Now, there's also pharmacological stress tests. Now, this is an interesting one. It's typically used for older patients who are limited in their ability to exercise, either due to orthopedic or musculoskeletal limitations, or even just muscle weakness. So what it does is it uses certain medications that can be administered intravenously and essentially stimulates the effect of exercise, right? So some drugs can increase heart rate, and so without having this person actually exercise, we can induce that same effect via drugs, okay? And then echocardiography. This essentially uses a sensor, or a coordinating sensor, to bounce these ultrasound waves off the heart, and then again, it creates this image of a working cardiac muscle. And with this, you can actually see valvular dysfunction, if there's any abnormalities within the wall itself, and then also if there's any portions of the heart that have been damaged by a heart attack. So that's where this echocardiography can be really helpful. Now, we also have some more advanced tests. The coronary angiography, which is also known as a cardiac catheterization. And based on the name itself, you kind of can guess what happens. Basically, you insert a catheter into an artery in the leg or the wrist, and you thread that to the heart. Then once that catheter is there, they inject a dye, and that flows through the coronary arteries, feeding to the heart muscle. So then what this does is it enables the cardiologist to see, based on that dye, narrowed spots and potential blockages via X-ray imaging. And then we also have some newer tests. So computed tomography or tomography angiograms. So that we typically call CTAs. These CTAs are used to really quickly determine whether significant plaque deposits have been built up in the coronary arteries. CT is now increasingly used to detect calcium, which is important in the coronary arteries, because we know that calcium, the higher amounts of calcium in those coronary arteries, are highly predictive of future cardiac events. So we'll pause here and do a quick learning recap. I want you to be able to list and describe at least 3 of the basic cardiovascular assessments. What are the 2 primary ways of doing an exercise test? What equipment is being used? When would a pharmacological stress test be used? And what is a coronary angiography? I'll pause here and I'll see you for the next lecture.